The Refresh Smile is a procedure that I have personally been performing for almost 7 years now. And I was very fortunate to get a very, very high level experience early, doing hundreds and hundreds of cases each year. And what I recognized once I started doing the procedures, which I initially only did with prosthodontists, is that a lot of my referring doctors, my referring restorative dentists that I worked in my private practice, absolutely have the knowledge and the skills and the passion to offer this procedure very successfully to their patients. So from a very early point, I started working with doctors that were comfortable with me to bring it into their practice. Now, there are many things that we do to help you be successful in your practice. One thing that we do is a lot of hand holding, first of all. And we don't really expect you to jump into the operatory and complete the procedure. One educational module we have is actually for your whole staff, because what we've learned is that dentists who have their staff educated and on board become very, very comfortable with the procedure. And the staff, incidentally, become very, very good proponents of the procedure. They identify patients, they communicate with patients, often better than we do as dentists, and they get patients excited about this. So we help to train your staff so that you can be successful in your own office, first of all, at getting the patients to even consider the procedure. Part of that module is that we will provide some hands-on demonstration of the different techniques and steps that happen throughout through the process. We'll start with one, patient identification. We'll show you models of what happens on the day of conversion, where we convert the patient from a denture to a bridge. And we will actually have the lab come to your office, if you prefer, to make you successful at creating the final bridge, because usually on the day of the surgery, that's a provisional bridge. And then on the final step, you'll make a final bridge, which is about 4 or 5 months later. We provide you marketing materials that you can give to your patient that shows this is not a procedure that you do just once in a blue moon. And the marketing material corresponds well with our marketing material, so the patient knows when they come to our office that you obviously work with our office and there's a continuing of education and care. Many of our referring doctors are not comfortable with presenting large treatment plans and large fees. My staff and I are very, very comfortable with that. We have access to numerous financial arrangements that patients often take advantage of. We've learned very early on not to judge our patients, that you never know who can make arrangements and is willing to accept treatment. And that the treatments are actually paid in full, so that by the time you come to the office for the day of conversion, you will actually receive your payment in full for your treatment.